Thank you for choosing Axxess On Demand. Axxess believes in continuing education, and we create content to empower you to learn and grow anytime, anywhere. Let's get started.
Hello. Thank you for joining us for today's webinar detailing what you need to know about managing personal protective equipment during the coronavirus COVID-19 pandemic. My name is Molly Casey, and I'm the Vice President of Marketing for Axxess. Before we get started, let me tell you a bit about Axxess. Axxess is a leading home healthcare technology company offering a complete suite of easy-to-use, innovative software solutions, empowering home health, home care, and hospice providers to grow their business while making lives better. Today, you will hear from Carol Javins and Mike Carr. Carol is a registered nurse with more than 20 years' experience in the hospice and palliative care field. She has worked in hospice as a field nurse, clinical manager, and inpatient unit manager over the years, and also has extensive experience in QA/PI management and staff development. She currently serves as a hospice implementation specialist with Axxess. Mike Carr is a physical therapist and clinical support specialist at Axxess. His clinical expertise is critical to the development and training associated with Axxess's home health analytics in the company's complete suite of solutions. During his time at Axxess, Mike has helped the company further develop OASIS scrubbing, agency analytics, and PDGM-related software enhancements. Mike and Carol, over to you.
Hello, everyone. This is Mike Carr, and thank you again for the introduction, Molly, and thank you all for joining us for this webinar on personal protective equipment. Today, we're going to cover a variety of topics, but the objectives that we'll cover will include certainly defining what personal protective equipment is, discussing how COVID-19 is transmitted and trying to clear up some of the confusion around that topic, discussing the ideal level of PPE for home health and hospice providers, discussing the national shortage of PPE and touching on the supply chain. Also, we will include information related to non-traditional solutions to PPE shortage and how we can support the Axxess agencies and the home health industry in general through this time of crisis as it relates to PPE. And at the end, we'll have a very brief introduction to the Axxess COVID-19 PPE resource page and the related thought leadership that we've been providing there. We'll go ahead and let Carol go ahead and do the bulk of the presentation, and I'll join you again in a few minutes.
Thank you, Mike. So how is COVID-19 transmitted? So COVID-19 is transmitted through respiratory droplets that become aerosolized when you cough into the air, or through medical procedures such as suctioning and intubation, where the secretions, respiratory secretions, become very fine and they can travel up to 6 feet through the air from the infected person and live on surfaces. And the time that the virus lives on surfaces depends on the material of the surface. So it can be in the air for up to 3 hours, although that's less likely for coughing and more for the aerosolizing medical procedures. It can live on plastic surfaces for 72 hours. It can live on stainless steel for 48 hours, 24 hours on cardboard, and 4 hours on copper, and this is per a study in the New England Journal of Medicine. However, those numbers can be a little frightening until you realize that the amount of virus present at the end of those times is less than 0.1% of how it started. So theoretically, an infection could be possible from surface contamination at the end of those time periods, but it is highly unlikely. So when the droplets are in the air, they can get into the mucous membranes of the eyes, nose, and mouth of others, where that's where it can cause the infection. They can also potentially be picked up by your hands from surfaces. And then when you touch your mouth, your nose, and your eyes, you can transmit the virus to your mucous membranes. And recent information says that they believe this is most likely how most of the cases that are community transmitted are being transmitted. So, and COVID-19 has been found in the feces of infected persons, and that's important to recognize when providing personal care to a patient with known or suspected COVID. There is currently no evidence that COVID is passed through any other bodily fluids. So What is PPE, or personal protective equipment? So PPE in the healthcare setting is defined as equipment that's used to help keep healthcare workers safe. So gowns are important here. They're fluid resistant at best, and some are fluid impermeable. And this is to help protect the wearer's clothing and skin from bodily fluids. Generally disposable and generally non-sterile, except for surgical gowns, which are sterilized in cloth. And the gowns are meant to reduce transmission of microorganisms between people. So if I have a patient with an infection, in an ideal situation, I take the gown off when I leave that room so I don't pass the organisms from one patient to the next. Gloves are also meant to protect the wearer from the environment, and they're always meant to be used with hand washing. Best practice is that you wash your hands before putting gloves on, and then you wash your hands after taking the gloves off. Now, there's multiple types of masks. Masks are getting a lot of attention in the news right now. So we have N95 masks, which are meant to protect the wearer from the environment. So it's meant to keep germs and other particles that are in the air from getting into the mucous membranes of the nose and mouth of the person who's wearing it. For N95s to be used appropriately, it's supposed to make a seal on your face, and that seal is confirmed by fit testing the device. The material in an N95 is also very thick and can be challenging to breathe through for long periods of time. Surgical masks generally are the ones that tie behind your head when you put them on, and those are to protect the wearer from droplets that may be infectious, as well as from splashing. There's a lot of different levels of protection depending on the fluid volume that might be present with different types of surgical masks. Procedure masks are what we think of as isolation masks. They have elastic, usually, that loops behind your ears. And that also protects the wearer from droplets that might be infectious. The surgical and procedural masks are meant to protect the environment from the wearer, so I don't breathe things out onto you, where the N95s are meant to protect the person wearing it from things in the environment. And then with eye and face protection, we have goggles that protect just the eyes and not eyeglasses. You have to have the goggles that fit to your skin and make a close to a seal. And then your face shields that protect your face, nose, eyes, and mouth that come down around the sides of your face and then past your chin. So that's meant to protect from splashes and sprays and any aerosolizing that might be in the area. So the supply chain is in the news a lot, and where is the PPE at, and how can we get more? So like most goods supplied in the United States, the supply of PPE and the market is based on demand. The U.S. PPE supply chain provides sufficient product to meet the anticipated normal market demands with minimal ability to immediate surge protection. And then that gives you a challenge in having these large unexpected increases in demand that can occur with a public health response like what we're in today. So when we are in the periods where we don't have enough PPE, we have this chain of people and agencies in the government that are going to help us. So on the far right, you'll see that the county and city emergency management is who our agencies should be contacting when they're not able to procure their usual PPE from their usual suppliers. Then the local emergency management system coordinates with the state emergency management agency. And then the governors in the states will coordinate and make a declaration of a state of emergency in their state, which begins the process of requesting federal assistance. And if the president declares an emergency or major disaster using the Stafford Act or the Emergency Assistance Act, that applies to be able to help all of the states that are considered affected by this to be able to now use FEMA to be able to get assistance for the state. So FEMA will then work with the state emergency management in getting supplies to them, which are then brought down to the state and county, your local emergency management. So the CDC has these supply availability levels that they have written instructions for how to use all of the PPE depending on the availability level of the PPE at the time. So the conventional capacity is what we consider our ordinary use, where we have things that are disposable. We have them for single use. We throw them away after each patient, or we reuse them according to the specific standards for something like a cloth surgical gown that is sterilized afterwards. A contingency capacity is where you're going to change your daily practices, but those daily practices shouldn't have an impact on patient care or healthcare provider safety. Your demands are exceeding your resources, but it's not yet considered to be outside of our complete standards of care. Crisis capacity is where we are now in some areas of our country. So that's where we're looking at alternative strategies that may not be in line with what we consider our normal standards of care in the United States. Now, implementing contingency and crisis capacity strategies is something that agencies need to coordinate with their local emergency management programs. So we, as agencies, will not find ourselves in regulatory hot water if we follow the steps that we need to let the appropriate federal, state, and local public health partners know that we are out of supplies or running low, and they will then coordinate to try and get us more. Our regulatory bodies will look at what we did during these times and understand that we have shortages, but also be looking to see what we're doing to try and coordinate getting more supplies. So in the home, where most hospice and all home health is being done, there's some different PPE use that CDC is recommending that's not the same as what we're using in the hospitals. So in the home, what always is the first thing to start with is your hand hygiene. And then it is recommended to put on your personal protective equipment before you enter the patient's home, preferably outside the front door. There would be the equipment and also a garbage can for being able to dispose of your PPE as soon as you leave the home. You should clean all equipment that you use in the patient's home, your stethoscope, your blood pressure cuff, your laptop, your telephone, pulse oximeters, any of those things you should be cleaning with an EPA recommended agent to be able to eliminate the viruses and bacteria on the surfaces. And then you perform hand hygiene again before you go into your car or before you go to drive to another house. You are going to make sure that you are as clean as possible. There's a lot of talk about N95 respirators in the home. Like I had said before, the N95, you have to have your fit test, and it's going to work to prevent exposure to infections that are transmitted via airborne routes. Not generally needed for droplet routes, but there's a lot of conflicting reports about who needs the N95 respirators during the COVID-19. In the home environment, the CDC has not at this point recommended the use of N95s for either patients or caregivers in the home. In the hospitals, they are recommending the N95s for procedures when there is a fine spray and aerosolization might occur, such as a medical procedure called a bronchoscopy or intubation or suction. So for those where you're going to have that fine aerosolization where the droplets can live in the air for the 3 hours, they are recommending using the N95s for those procedures. Prior to the shortages, they were recommending it to be doing any of the care in the patient's environment when you were within that 6-foot environment space in the hospitals. At this time, there is no CDC recommendation of using the N95 respirators in the home settings. I know that there's a lot of changes that happen on a regular basis and it's hard to keep up, but as of this time, there is no recommendation for using N95s outside of a healthcare setting. Face masks, the procedure masks, your surgical masks, we need to make sure that we are optimizing the supply of our face masks as much as possible. We should use them only when indicated, because just walking around to the grocery store at this time is not an indication for using a face mask. The face masks are often being used by the patients in their environment to help source contain so that the patient's spray is not getting into the environment. It's also being used if you are doing care in close proximity to the patient. So there's a new thing that we're doing with the contingency and crisis about reuse and extended use. So reuse of face masks is that you remove it and discard it if it's soiled or damaged or it's hard to breathe through. And those are good for your isolation or procedure masks where they are easily taken off with the ear hooks. And there's been some very industrious nurses that I saw in a picture where they are putting buttons on their hair protectors so that they can hook them on there to protect the skin behind their ears, which I thought looked like a fabulous idea. So if a face mask is going to be reused, you would take it off and fold it so that the outer surfaces are in contact with one another. And what you're going to be touching when you get that back out to put on again is the inner surface that was facing the clinician and not the part that was facing the environment. And then you can put that in a clean, sealable paper bag or a breathable container, not in a plastic bag, but in a paper bag. And when we are having extreme shortages of face masks, prioritize the use for times when you're doing care activities where splashes or sprays are anticipated, such as wound care where you're cleaning something and the water can splash out. If you're doing suctioning for a person that doesn't, as far as we know, have N95 or anything that looks like it could potentially be an infection. Any activities where prolonged face-to-face contact with a potentially infectious patient is unavoidable. And if that would be in a home setting, if the nurse is coming in to do an assessment where they're going to listen to the patient's lungs or heart or abdomen, and they're going to be within generally a 12-inch space to be able to do that, you're going to want to make sure that the caregivers are protected with the mask as well. If there's an aerosol generating procedure such as suctioning, like I had said, or if you're going to be doing any type of intubation, which is generally not done at home, but your EMS people might have to come to the home and intubate someone, these types of masks will be used if there are no more N95s available. So to be clear, we want to make sure that people know the difference between the masks versus the respirators. The N95s are considered respirators. And there's a lot of confusion too because the World Health Organization is recommending to use surgical masks for pretty much all of the care except for aerosol generating procedures. And the CDC is saying to use them much more often in the healthcare settings. So when you're reading the World Health Organization's recommendations, do recognize that the World Health Organization is making recommendations for not only the United States and other first world countries, but they're looking at making recommendations for best practices across the entire world where they might have on a regular basis much less PPE supplies than what we have here in the United States. Both the CDC and the World Health Organization are indicating that source control is a very good way to try and contain the infection, and that would be putting the face mask on the infected patient and then having that infected patient stay in a room in their house that's just for them without a lot of in and out traffic. So that will give a good amount of protection for others that are living in the home environment with the patient as well. So when we move on to the next PPE that's used often is gowns. So the gowns, like I had mentioned, will cover your arms and your clothing. And as the COVID-19 does live on surfaces, it can live on patients and our caregivers' clothing. So we're looking at extended use versus reuse. So extended use of isolation gowns would be you would wear the same gown and not take it off. You go from patient area to patient area without taking the gown off. Preferably, you're taking care of all of the patients who have suspected COVID-19 and you're going to be using that same gown. Whereas reuse of gowns is where you take it off and put it back on. So that's best with the cloth gowns, surgical gowns, and any other gowns like that because they are easier to tie and untie. The disposable isolation gowns often tear when the ties tear when you try to take them off. So prioritizing the use of your gowns is very important. So walking into a room and having a visit with someone does not require use of a gown. But if you're going to be doing personal care, such as a CNA who's giving a bath, and they're going to be in very close proximity to the patient's respiratory secretions as well as their feces. And as we mentioned, COVID-19 has been found in feces. You want to make sure that you're as protected as possible. Coveralls is another option where it's just the full suit from toe to neck and your sleeves. Those are washable generally, although there are some disposable ones that have been used. You see those in the pictures a lot from overseas where the healthcare providers are wearing those. So in the crisis where no gowns are available, no coveralls are available, some of the alternatives that the CDC recommends are using disposable lab coats, reusable and washable patient gowns, reusable and washable lab coats, and disposable aprons. So these options are still covering your skin and allowing there to be one extra layer between your clothing that you're wearing and the patient so that you can take that off and be able to wash it. And there are quite a few gowns always in healthcare facilities, either nursing homes, sometimes in the assisted livings, although not usually, and there's plenty of them in the hospitals. So eye protection is also something that's very important because, as we recall from earlier in this presentation, the eyes are a vector to be able to have the virus go into the mucous membranes. So trying to use only when indicated is the best way to be able to extend the use of your eye protection. So when you're going to be doing face-to-face contact within that 6-foot area of the patient, when you're going to be doing care when spray is anticipated, again, the suctioning, bronchoscopies, intubations, face protection is very helpful. But you don't need to have eye protection just to walk in the room. And at this point, except for those very close contact, home health and hospice contacts, it's not recommended to just be in there for, say, a social work visit where you're sitting across the room from the patient and not going to be getting in face-to-face contact or doing any spray generating procedures. So when you're going to be cleaning or reprocessing your eye protection, there's very specific steps that the CDC has recommended. So you wear gloves and wipe inside and then outside of the face shield or goggles using a detergent solution or cleaning wipes, and then wipe the outside with a soft cloth saturated with an EPA registered hospital disinfectant solution. That will kill all of the virus and bacteria that is going to be on the outside of these goggles or face masks. And then wipe the outside with clean water or alcohol to remove the film from the EPA registered disinfectant and thoroughly dry. There are some EPA registered hospital disinfectants that recommend air drying as opposed to wiping them dry. So always check and see what are the directions specific to the EPA registered disinfectant that you are using to make sure you're following the appropriate steps. And then, of course, at the end of all of this, you're going to remove your gloves and you're going to perform hand hygiene. Hand hygiene is something you've been hearing about for years if you work in healthcare, and it is always the single most important step for healthcare personnel in remaining healthy. Now, studies have shown over the years when you check the healthcare provider's hands after washing that there are areas where we still don't do a great job. Washing your hands for 20 seconds or more with the hot and soapy water. Make sure you get the backs of your hands and your thumbs, and also make sure you get under your fingernails and around your fingernails, because if you're just getting your palms and your fingers that are facing your palms, there's large amounts of hands that are still going to be vectors for transmitting bacteria and viruses. If you do not have visible soiling on your hands, you can use hand sanitizer. Hand washing with soap and water is always the best, but alcohol gel can be effective in certain situations, but it must be a concentration of greater than 60% alcohol, and you must use enough of it to completely cover your hands and allow it to air dry. One of the things I've seen is that people use maybe the size of a nickel or a dime of alcohol gel and rub it on their palms. In order to fully saturate your hands, you have to cover your palm with a big amount of this alcohol gel, and then your hand should be very, very wet when you are covering your hands. Supplies of this are limited, as we've all heard in the news. Pharmacies have been allowed by the FDA to formulate hand sanitizer using the World Health Organization's recipe. And lately, what I've seen everywhere is that there's distilleries that make vodkas, whiskeys, all the different liquors all over the country that are using the same World Health Organization recipe to be able to produce hand sanitizer. And some of them are giving it to healthcare providers at absolutely no charge. It's a great thing to be able to use something that they know is effective. They're keeping people working in their area and helping healthcare providers. So that's been a really great thing to see. There are some non-traditional solutions that the CDC has said are options to be able to do during this time. PPE during the crisis capacity being what it is, there are these alternate strategies. You've seen a lot from the make homemade masks that is out there, and we'll talk about that a little bit more in a few minutes. Some of these non-traditional solutions are not considered PPE by the CDC or World Health Organization, but they are going to allow some level of protection. Some of the things that are being created are actually going to meet the criteria of PPE that the FDA has. If you can see here in this picture that Bauer, the hockey equipment maker, is perfectly capable of making a full face shield there. You see in here that New Balance is making face masks for hospital, and that certainly looks like, although I can't confirm, that does look like it's a fairly thick material that could in fact even meet N95 requirements, although I can't know for sure, but it's definitely thick. But in looking into all the different industries that are working to try and make PPE, I saw that high-end couture fashion designers are working on making masks and gowns, and some of these are actually meeting the Department of Health and Human Services definitions for PPE, that it is protective enough to be able to assist people in the best way possible. So it's really heartwarming to see all of these companies that are refocusing their attentions on protecting our healthcare providers. So as we mentioned, the hand sanitizer, the pharmacies received a waiver to be compounding this, especially your compound pharmacies. And those of us who work in hospice know that our compound pharmacies can make almost anything for you if they have the recipe, and they're doing a great job. You can see in here that Anheuser-Busch is doing this as well. We've got water companies that are working on providing the bottles for people. It's really everywhere, all these companies that are doing this to help the healthcare providers. It's very heartwarming. So the homemade masks, which have gotten a lot of attention, are very heartwarming as well, in that there is pretty much everywhere all over the country and even all over the world, you're seeing people coming together and making these homemade masks to try and help people in the healthcare field have some protection. So the studies that have existed have shown that homemade masks do not meet the criteria of PPE. They do not have enough filtration to be able to capture viruses and even some bacteria, although bacteria are a little larger, but they do protect some. And so the studies that have looked at what types of materials work the best for making the homemade masks, strangely, the best material that is very, very close to the N95 is vacuum cleaner bags. And those have enough thickness and filtration to be able to keep most all of the viruses out that an N95 does. However, it doesn't really feel comfortable to have a material that thick on your face, and caregivers have had to take them off more quickly, which does not help with any protection if you can't keep it on. So the next level of protection was dish towels, and then that was followed by cotton blend t-shirts and 100% cotton t-shirts, and with silk and linen being the least effective materials. So why are we using t-shirt materials recommended everywhere? Well, the studies have also shown that that's one of the easiest ones to breathe through. And so if you have a mask on that you can't keep on because it's so uncomfortable and you can't breathe, you're not going to be able to have any effectiveness. It might as well have nothing on if you can't wear it. So this has been really helpful to see all of this, and people are trying to make masks with the right materials to be able to help people. And some have also been using these to cover other masks. So there's some double masking going on to try and extend the protection level of the other surgical masks, procedure masks, and N95 masks. So one of the things, or multiple of the things that we want to make sure that we emphasize for agencies is to be proactive. Ordering supplies early and also coordinating with your local emergency management to try and order more supplies through them, because these supplies are universally limited and delivery is slow. While there are all of these efforts to ramp up PPE production across the industrial world, with different masks, gowns, N95s, you see people making ventilators as well. That's great. We will have more supplies coming out, but right now they're not there. And any change in focus for industry does require a few weeks to be able to start production and then be able to ramp out production and be able to get it out to you. Conservation is as important as procurement. This cannot be emphasized enough. There is the right amount of PPE that you should be using. Overusing the PPE on situations where it is not needed is going to result in having less PPE for the situations where you do need it. Making sure that you're trusting the science and going with the recommended standards. We saw that there was some research recently that a lot of home health agencies are saying they need N95 masks, and they're very concerned about not being able to have their N95s. But the science is not showing that N95s are recommended or required in the home health setting, in the home hospice settings at this point. So try to follow the recommended standards and trust the science that we have at this point. And again, we cannot overestimate, how much faster we will go through our PPE if we use overprotection now. If we're not going to be able to take care of any patients because we've used all of our PPE for patients who don't need it, it's going to hinder our ability to do what we need to do for patient care. So now I'm going to turn it over to Mike to talk about how we can work to be able to spread this information and be able to get resources to our agencies to help.
Great. Thank you, Carol. You did a very nice job covering some very important topics for all of us, so certainly appreciate it. Here at Axxess, we're very proud that early in this COVID-19 pandemic, we identified the fact that PPE was going to be a major concern for agencies and for the public in general, but certainly for home health and hospice agencies was our focus. And we put together a team of people to try to think, well, what can we do to help? And our first thought was, well, we need to try to find a way to connect agencies with the resources that are available. And we'll touch on that in a little bit, and how you can help us with that as well. The second thing that we thought that we owed it to the industry to do was to provide as much thought leadership as we could. So certainly this webinar is an example of what we try to do to get the word out. Again, based on science, based on the information on the CDC website and the World Health Organization website, and try to keep people focused on the accurate and meaningful information, not getting information about PPE from Facebook or from social media or from non-reliable resources. So we've developed a series of webinars, extensive series of blogs that we'll direct you to here in just a few minutes too, and we'll continue this process for the foreseeable future. This unfortunately is not a problem that's going to resolve itself quickly, and the problems will continue to evolve, and the understanding will continue to evolve, and we'll certainly continue to do our best to share that information with you for quite a long time ahead of us, unfortunately. And then also working about or what we could do to help understand and help spread the word about distribution of supplies in those rare cases where someone has supplies that they're willing to share. And I have a nice little story to share with you here in a moment. And then just again, understanding how does the supply chain work. So we'll have another webinar in the very near future, working with our friends from Cardinal Health to partner with them to help explain the supply chain system, how it works in the best of times and how it's working now in challenging times. So connecting agencies to resources. This is a screenshot from our resource page. And we have a short list. It's actually a little bit longer now from when I took this screenshot, but trying to connect PPE supplies to those in need. And we understand that everyone's in need. So this is a evolving list. Like I mentioned, there's 2 or 3 more on there even by this point. But I would invite you all, as if you are aware of any suppliers that have supplies or any resources that we should be able to connect to, or we would like to connect our agencies to or the industry to, please send me those links and I'll research them a little bit to make sure they're valid, and we can add those that are appropriate here to this list. So just send an email to mcar@axxess.com and I'd be happy to do the legwork there and make sure the right ones get added to this list. So that's certainly a very important part of what we can do for each other, what you can help us with and what we can help you guys with and the agencies with. So hopefully as time goes by, this becomes a nice, solid, reliable list of resources that people can check out. The project N95 is particularly interesting, where you're able to put in what you need and they prioritize things and submit it all to the larger suppliers, and seems like they're doing a great job kind of distributing things as well as they can. Everyone seems to need more than what they have, but we're all working through this together. And here is this was a 10 or 12 question survey that we sent out recently that many of you may have received and replied to. At this point, there were 244 agencies that had answered. There's probably twice that many now, but the percentages stayed about the same, so we didn't bother to update our screenshots. But on the left-hand side, we just wanted to see, do people feel like they're adequately supplied or not to have enough PPE for their staff? And as you can see, 75% or so did not feel like they had enough PPE, and 25% or so felt like they were in pretty good shape at this point. Again, that's going to continue to change as the pandemic shifts to different parts of our countries, and some parts hopefully start to get things under control, and it continues to expand in other parts. But the slide on the right, I think, is more interesting information, particularly as we look at the very top green line, as we think about the agencies responded that their most critical need was for the N95 masks. Well, Carol just did a great job explaining to us, again, with science as her foundation, that we really don't need the N95 masks in home health and hospice that we may think that we need at this point. That if we follow the CDC guidelines, that's certainly not where our mindset should be. We should be much more focused on general face masks or much more available face masks than we should be worrying about N95s for the most part, unless we're dealing with infected patients, which we will be doing that more and more as the situation evolves. But short of that, I think that the vast majority of the time we're well protected with surgical face masks or more traditional type face masks. We also can see that there's shortages of other materials that we need, gloves and gowns and hand sanitizer as well. But I'm sure that everyone's putting a lot of effort into supplying or producing these things as quickly as they can, and we will hopefully see these shortages turn around in the relatively short-term basis, although the need for them and the consumption of them is at all-time high levels as well. So on our resource page, as we think about the thought leadership, these are just some examples. Again, things are happening quickly, so we've certainly added to this in the last day or two since these slides were put together. But we have a series of blogs. Carol's done one on the COVID-19 infection management. Arlene Maxim has done one with us for the benefits of telehealth during the infection pandemic. And there are others there at this point as well. We have a series of recorded webinars that our staff has done on a variety of topics, emergency preparedness and infection control, that a couple of our staff members put together. Wendy's a physical therapist and Matt's an RN. And home health and hospice public policy update. That one needs to keep getting done frequently, because by Deb Hoyt, who's our Senior Vice President of policy, because the policies keep changing on a daily basis, which for the home health industry, I think there's some good things happening there as well. So I would invite you to take a look at those webinars when you have some time too. We also have a series of links and downloads there of again, the right information that we want you guys to be using and you to be referring your patients to, because it's the stuff that's most reliable. It's from the Johns Hopkins, and it's from the CDC and CMS and NAC and NHCPO, all the reliable people. We certainly don't want to be directing people to information that's not believable and not accurate. So there's tons of information there related to resources, and again, evolving on a daily basis. So if you visited it, come back and visit it again in the near future, because it'll be different and better. Certainly the supply chain Carol mentioned is and the distribution is the weak point of this whole system that we have in place. We were not well prepared for a pandemic. I think that if we look back at past epidemics and pandemics, I think that there were some lessons that could have been learned and should have been learned, and I think we're kind of repeating some of those same mistakes that we've had in years past and decades past. But maybe this will be the one where we have a adequate national supply built up that FEMA can tap into, and the makers are more prepared to ramp up their supply production in situations like this. But for now, it certainly has been shown to be a weak point. But I did want to talk for a second just about this Grace for Impact. Grace for Impact is an organization that had planned a mission trip. I believe it was to Africa. And as part of their mission trip, they had stockpiled supplies that they were going to take with them. Everything happened with the bans on international travel, and their mission trip obviously was delayed or postponed. But Grace for Impact had these supplies in hand, and they approached Axxess and said, can you help us find the right places to distribute these to? So we're very fortunate that they trusted us, and very fortunate that we also had the connections with agencies in the North Texas area that were in need of supplies, and we're able to connect the dots there. So there may be situations in your areas where there are these unusual circumstances where there are supplies available. So please be attentive to those sorts of situations. I've heard recommendations of approaching nail salons and tattoo parlors and those sorts of places that have that use masks, the dentist's office, that maybe aren't performing business as usual, that may have supplies that could be redistributed. So we need to think out of the box and be creative in our solutions, because those are the times we're in now. So keep all those sorts of things in mind. We've stayed in touch with the top 3 U.S. supply companies, Medline, Cardinal Health, and McKesson. They are all working hard to right the ship. Obviously, that's very important to them to do that. As I mentioned, in a couple of weeks, I believe we have a webinar planned with the folks from Cardinal Health to speak to those topics as well. We'll certainly make sure you're aware of when those things are ready for production. And again, these are the sources that we have on our website that I would invite you to touch base with me if you have others that we should add to that, where there may be a way to connect, again, the needy agencies with the suppliers or the individuals that may have materials that they can share or sell, and we can all get through this together, as has been said often. So just in summary, we must accept the finite disappointment, but we must never lose infinite hope. I think we all need to keep that in mind. Dr. Martin Luther King was a brilliant man, had some great quotes, but I think this one fits well in the times that we're in, that it's not going well, but it will go better, and we need to keep our eye on the goal in the long run, and work hard through the short term to get there. So, and again, here's just the website, www.axxess.com/COVID-19 will take you to this video that our CEO and founder, John Olajide, has posted, as well as many other resources that can help us through COVID-19. And there is a section there on specific on PPE, and a new section coming very soon related to the CARES Act and some of the financial pieces to to what's going on for ourselves and agencies. And I think we'll turn it back over to Molly to wrap things up for us.
Thank you to Carol and Mike for sharing your thoughts and wisdom with us today. To find our full suite of COVID-19 resources, please visit www.axxess.com/COVID-19. Thank you all for joining us today as we deliver on our mission to empower healthcare organizations and professionals with the world's best technology solutions.
Thank you for joining our on-demand training today. Axxess is the only home healthcare technology company approved by the American Nurses Credentialing Center to offer continuing education credits and the most recommended home health software on Software Advice. You can watch more on-demand training videos through our industry-leading help center or at axxess.com, where you'll find tutorials, blogs, white papers, and answers to frequently asked questions. Axxess, empowering care anytime, anywhere.